Hey everyone, my name is Mariam Safi and I'm a first year PhD student at the University Hospital of Southern Jutland, and today I'm going to present the first part of my PhD study, which is supporting and managing the resilient performance of an ambulatory care. So I will start with sharing my presentation. So let's begin. So to just give an overview, where I have highlighted red, it is where the University Hospital of Southern Jutland is located. So the aim of my study is to support and get an enhanced understanding of the resilient performance of the internal medicine ambulatory care. And the internal medicine ambulatory consists of nephrology, lung, and endocrinology ambulatory. They are under the same big department and have the same leadership. So the background for this research was that our hospital is undergoing restructural changes to improve patient pathway. And one of the initiative is co-location of the ambulatories under the same roof to improve the everyday clinical work for the healthcare professionals, and at the same time improve the patient pathway for chronic patients. So we saw this as an opportunity to use the RAG to get an understanding of our system, and at the same time use RAG as a managing tool to implement quality initiatives and support the changes. So the study process looks like this. The part one, developing the RAG questionnaire. Part two, the application of RAG. Part three, presenting the results and discussing future direction and implication. And hopefully part four is to repeat the RAG a second time, depending on what we do. So the method is, of course, it's a mixed method study where we have used both qualitative and quantitative methods to in this research. So before I dive into the method, I will just explain what I did the preliminary aspects of the study. So in the beginning, what I did was I got the leaders and managers involved in the process where I presented the RAG and also what I wanted to do. And then I also had a virtual meeting with Erik to discuss how I could use RAG in my setting and also at team level. Afterwards, I introduced the RAG to the healthcare professionals, nurses, and physicians in their morning meetings, and also discussed how they could assist me in this process. So in order for me to generate the RAG questions, I did 3 small focus group interviews with nurses and 12 individual interviews with middle managers and physicians. And please keep in mind that I did this in COVID time, so I could only do small focus group interviews, which consisted of 3 to 4 participants. And afterwards, Afterwards, I transcribed the interviews and the thematic analysis of the interview transcripts based on the 4 resilience abilities. And with the assistance of my supervisor, we generated the initial items. And afterwards, I did a few rounds of expert group expert group interviews where I got feedback on my items. So the first expert group discussion was with the head of department for the nurses and physicians and my co-supervisor, where we looked at the items and they rated each item from relevant to non-relevant to relevant, and I also looked at if I had used the right terms and if there was any duplication, if the content was proper, and also if the items measured what I wanted to, what it should measure. And after the first round of expert group interview, I had a second round of expert group interviews with the nurses and physicians, where they also rated my questionnaire. This was done through individual interviews. Because of the code, I couldn't organize a big focus group discussion. When I reached content validity, I did a pilot testing with 5 participants, where I sent a link of the RAC survey, and they filled it out, and also evaluated how long it took, and they thought aloud if there was anything wrong with the questionnaire. I got feedback on that also at the same time. So the RAG questionnaire looks like this. It has 26 items aside from the 2 background information about their profession and work experience. It is a closed-ended questionnaire. Sorry, it's in Danish, so you can't read it, but I have highlighted one of the questions. And for example, it is one of the questions is that in my department, we plan with the right amount of human resources to perform our daily task. And then they had to rate from never to always, like never, sometimes, often, or always. So the quantitative part was the survey where I sent the RAG questionnaire to the managers, nurses, and physicians using REDCap. I excluded nursing students and medical students. Response was 44, and I did descriptive statistics and data where I also looked at the normal distribution in order for me to calculate overall mean scores for each of the 4 resilience abilities. And I also calculated the mean scores for each subgroup in the survey with the standard deviation and depicted the data in the radar charts. So the results looks like this. The figure 1 shows the distribution of the respondents. As you can see, it's very equal between physicians and nurses, and we have 5 middle managers with both physician and nursing background. And in figure 2, we can see the work experience. It shows that most of the participants have more than 10 years of work experience. So the overall RAG looks like this. If we look at the ability to respond, we can see that in most of the aspects of the response, they score very well. However, the ambulatory score very low on flexibility and interruptions. And if we look at R1, the questions was that there is flexibility in my ambulatory program, that is time flexibility. So sorry for the Danish translations, but that there is flexibility in basically that there's flexibility in my ambulatory program, which it scores very low, which means that there is not flexibility in the ambulatory program, which means that sometimes that the schedule is very strict and rigid, which means if a physician wants to do a consultation with a colleague about a patient, it's not always possible. The other is interruptions, which means that they experience a lot of interruptions in their everyday work, which prevents them from doing their work properly. However, the ambulatory score scores very well on other aspects. If one aspect that was very important both for the leaders and the employee was resources. So it was about that in the department we plan with the right amount of human resource or personnel to be able to perform the everyday tasks, and they do it most often. So that is very good. If we look at the ability to monitor, we can see that it's the amateur is doing quite well. The score is above average. If we look at M3, which is situation awareness, a very important aspect that in the it is that in the department we know when our colleague is under pressure and needs help, which is a very important aspect of monitoring. If we look at the ability to learn, we can see that the amateur score very well on learning culture, which is that in the department we have sufficient, that in the department I feel comfortable asking about something I don't know, and that is a good that's a good thing. And also L3 is about that I get the relevant answers to my questions, so they are very connected. However, they score low on feedback process, which is that in the department we have sufficient time to follow up on efforts or initiatives and learn from it, which they don't do often, that there's no time to follow up or exchange knowledge. That's something that they could work on in the future. Yeah, in the future. And if you look at the ability to anticipate, it also looks very well. One aspect that I want to comment on that they have scored very high is the expertise item A1. And it is about that in the department we have the competencies needed to carry out our work. So it's also for a system to be resilient. It's also very important that they have the right competencies to be able to keep the functions in a system or to handle the everyday tasks. If we go forward with the RAC subgroups, so this figure shows the RAC for each subgroup in the survey. And we can see that it follows the same pattern and trends as the overall RAC. However, if we look at the ability to respond, we can see there is some difference for the nurses. They score low in leveraging knowledge and interruptions compared to the other subgroups. And if we look at the leveraging knowledge, it is about in the department we can handle or undertake each other's function. This is something that the nurses score low on. An explanation could be that sometimes some of the nurses are very specialized in, for example, a test or a checkup, which the other team members are not able to do. And in order to respond quickly, it is something that they have to take into account in the future, that what happens if that person is sick, then they have to cancel every appointment. So it's very important to get everyone, it's very important to have that everyone has the same knowledge so that they can help each other, or if something happens that the other person can, or the other person can handle a colleague's function in the future. And also that the nurses have a lot of more interruptions compared to the other subgroups, which prevents them from doing their work, preventing them from doing or from performing their daily tasks. Otherwise, it looks the same as the overall RAC, but however, if we look at the ability to monitor, we can see that the middle managers score very high on organizational support. And if we look at the organizational support, it's about that in the department we have the opportunity to get an overview of the day's work tasks. And so they have, so it's easier, so they have the organizational support, electronics or technology to get an overview of the numbers, and also overview of the numbers. So that's a good thing, because the monitoring aspect also a part of job description for the managers, that they are able to have an overview of the things that happens in the system and in the organization. So, I have presented the overall the preliminary results to the head of the departments and the managers. And the key points from the meetings were that they would like to focus on the ability to respond and work on flexibility interruptions and leveraging knowledge in regard to nurses. However, there was not much discussions about the ability to respond because they scored low on some of the aspects. Currently, what they want to focus on is the ability to respond. So the next step is presenting the results to the nurses and physicians and using the results from the RAG to support and manage quality improvement, and also hopefully repeat the RAG next year after they have implemented quality initiatives. So it depends on if we have implemented anything. Otherwise, it doesn't make sense to repeat the RAG if there's no changes. So thank you for your attention. So this is a little bit different kind of format I have done it. So hopefully everyone have enjoyed this presentation. So for the Q&A, if there's any question, you are very welcome to ask or contact me. Otherwise, I am very keen to hear from others who have used or are using the RAG for this purpose, for managing change or for quality improvement. And I would like to hear how they have done it or are doing it. So thank you very much. I will stop sharing my screen.